Nosebleeds, what causes them and how to prevent them. Nosebleeds are caused by the bursting of microscopic, enlarged blood vessels in the frontal septum's mucous membrane. This may be the result of an accident or a disease and is prevalent among healthy adolescents. The bursting of microscopic, enlarged blood vessels in the frontal septum's mucous membrane causes nosebleeds. These can be caused by a traumatic event or by a disease, and are most common among healthy adolescents. Small nosebleeds are typically produced by picking the nose. However, additional local reasons include septal deviation, septal perforation, malignancy, and trauma. Cyclic vomiting is a symptom of acute rheumatic fever, acute sinusitis, arterial hypertension, and hemorrhagic disorders. Rhinitis is an inflammatory condition affecting the nasal mucous membrane. It is occasionally an allergy symptom, in which case it is known as vascular rhinitis and is typically caused by an infection. The most common infection that causes rhinitis is the common cold, often known as coryza. The nasal mucous membrane becomes congested, puffy, and edematous in acute rhinitis. This subsides rapidly, and the membrane returns to its natural state. After repeated episodes, especially in cases resulting from chronic sinusitis, this swelling becomes rigid and causes persistent catarrh. With the exception of recurrent bouts of allergic vasomotor rhinitis, all attacks are acute exacerbations of the same common cold. Typically, nose fractures are caused by direct trauma. Although fractures usually rarely result in catastrophic repercussions, the resulting deformity frequently leads to nasal blockage and facial ugliness. Immediate bleeding from the nose, both from the nostrils and into the pharynx, is typical following a nasal injury. There is an obvious enlargement of the soft tissues close to the nose and a distinct deformity. Nosebleeds can originate from two distinct parts of the nose, and it is crucial to know which area is affected as soon as possible. The frontal nosebleed. 90% of all nosebleeds fall into this category. Inside the nose, blood veins on the nasal septum are the source of the bleeding. This region is immediately visible to a physician when he examines your nose with an instrument. Rarely does an anterior nosebleed necessitate a trip to the hospital, as it is typically easy to treat. If a person has had their nose cauterized multiple times, it may be more difficult to stop a nosebleed using conventional treatments. The posterior nosebleed. This type is far less prevalent and accounts for the remaining 10% of nosebleeds. This sort of nosebleed originates in the far back of the nose. They are more prevalent among the elderly. It is nearly impossible for a physician to see the source of this type of bleeding. They can be extremely difficult to manage at home and typically require hospitalization and follow-up care by an ear, nose, and throat specialist. What causes nosebleeds? Our nose might bleed unexpectedly and suddenly from one or both nostrils, leaving us startled and surprised. If this occurs frequently, we should consider why it is happening and what we can do to prevent it. Find out what causes your nosebleeds, and you may be able to stop them permanently. Allergy to pain drugs. Bufferin, Aleve, Advil, Motrin, Anacin, and Excedrin all relieve inflammation and can impact blood coagulation and may even induce blood thinning. Many individuals are allergic to or develop an allergy to such medications later in life. I was diagnosed with a severe allergy to such medications at age 20. Most of the nosebleeds I experienced as a youngster and early adolescent were likely caused by the aspirins I took for headaches. I recently asked a pharmacist if a person was allergic to aspirin due to bleeding and what other over-the-counter pain drugs would be safe for that person to take except Tylenol. The pharmacist said that only Tylenol would be safe. Abnormal veins within the nose lining. Inside the nose are numerous small blood vessels. In some people, these blood vessels lay very close to the skin or lining of the nose. Being rough. Getting hit in a fight by an item or even wiping the nose vigorously with a towel after a shower can rupture a blood artery within the nose, resulting in bleeding. Head colds. When you have a head cold, be careful when blowing your nose and wipe it with care. When you have a head cold, the lining inside the nose becomes inflamed, and the blood vessels enlarge somewhat, making it much simpler for a nosebleed to develop than when you do not have a head cold. Bending over. Be cautious while bending over when standing, as the blood pressure levels in the brain alter, and enough force might build up to cause a thin blood artery in the nose to burst during bending over or even several minutes after being upright again. Winter nosebleeds. Winter is a curse for people who are prone to nosebleeds, as the low humidity levels of winter cause the air to become extremely dry. This causes the lining of the nose to become dry and almost brittle, while the skin covering the blood vessels develops small cracks and breaks easily in dry weather, resulting in severe nosebleeds. One cure for this is to put a small amount of Vaseline on the inside of each nostril with the tip of a finger before going to sleep or, if desired, during the day. This keeps the nose's interior from drying up, cracking, and bleeding. Your nose may bleed for a variety of causes. No major diseases are associated with nosebleeds. Only general coagulation abnormalities can induce nosebleeds, and they typically result in bleeding in other areas of the body, such as the mouth, gums, and skin. Nasal membranes are frequently infected when we have a cold. Nose trauma, such as picking the nose or inserting foreign objects, as well as blowing the nose too vigorously, can also induce nosebleeds. A dry atmosphere could also be to blame. Lack of humidity causes the nasal membranes to dry out. It would help if you opened your mouth in order to breathe through it. Pinch the soft portions of the nose with your thumb and index finger. Repeat the method for 10 minutes or until the bleeding stops. This will stop the bleeding by producing a tiny blood clot in the vessels. Do not blow your nose for at least 12 hours, as doing so may cause the thrombus to dissipate and the blood vessels to reopen. Then you can gently blow your nose to dislodge the developed blood clot. Applying a cold compress over the bridge of your nose may also be beneficial. If the bleeding continues or recurs, you should consult a physician. He may use a heated device or caustic chemical to cauterize the vessels if bleeding persists. If a violent blow caused the nosebleed, request an examination for anomalies in the diaphragm, which might lead to breathing problems in the future. After a nosebleed, one must be cautious for at least 12 hours. Avoid lifting large items. Do not take aspirin or other blood-thinning drugs. Do not smoke or expose yourself to a dry climate, as this will irritate the nasal membranes worse. Choose a moist environment instead to keep your nose moist. If the interior air is excessively dry, you can utilize a humidifier. Also, avoid picking or forcing anything up your nose.